wherever you are watching us, brand new episode of Family Time. Today we're tackling pharmaceutical sciences. We are going to talk more and to deepen more into the field of medicine, types of medicine for different diseases or different problems that we are facing in our life. But mainly first we're going to talk about the 6th Riyadh International Pharmacy Meeting. And it takes me great pleasure to be welcoming Professor Farouk Sakr, the Professor of Pharmaceutical Technology and the Chairman of Pharmacy and Medical Sciences at Riyadh Colleges of Dentistry and Pharmacy in Riyadh. Welcome to Family Time, Professor.
Yes, thank you.
This year, the 6th Riyadh International Pharmacy Meeting and Exhibition, it was under the title of Broadening the Impact of Pharmaceutical Sciences.
Yes.
What does that mean, and what were the main topics discussed?
Yeah, this means we have to cover wide varieties of pharmaceutical aspects, which most of conferences only focus on scientific papers. But in this meeting, we covered, for example, community pharmacy, relation of pharmacist with the patient in hospital. We covered aspects on clinical pharmacy as well. And we provided some research papers about the new research in the field of pharmacy as well. Besides, we planned for workshops, which were 6 workshops. Some workshop dealt with asthmatic patients and how to manage asthma in children and adult. What are the drugs used for treatment of asthma? And some other workshops spoke about diabetes, causes, management, and the new trend in treatment of diabetes. And other workshops were about community pharmacy and pharmacy patient interrelation. In addition to that, the Ministry of Interior supplied us with a workshop to give a momentum for guiding people about the harmful effects of drugs and how to avoid these matters.
So there was a cooperation between you and the Ministry of Interior as well. I know that the 6th meeting as well focused upon clinical pharmacy and future careers for the students who are studying at the College of Pharmacy. Let us know more about this, because a lot of students, when they go join the Faculty of Pharmacy, they think that all what they do or they are going to do after being graduates, that they are either going to sell drugs in pharmacies, or they are going to be medical representatives, and that's it. What are the new career for that?
Actually, this is the
Typical.
wrong. Yeah, this is the wrong idea about pharmacy after graduation for pharmacists. Just selling in community pharmacy or medical representatives. In fact, there is a wide range of job opportunities for pharmacists after graduation. For example, they can work in academics if they are graduated with reputed marks. They can work in Ministry of Interior, in the poison centers, or they can work in the Food and Drug Administration to deal with how to register drugs and how to check for proper working conditions in factories and these things. In addition, they can work in research as well. And they are very successful pharmacists doing this job, you know. It's not only community pharmacy. About clinical pharmacy, it is a new trend in Saudi Arabia, but it is an old trend in other countries like United States. outside. The pharmacist is charged to prescribe the drugs, not the physician. The physician, his job is to diagnose, and the pharmacist is going to follow the treatment and prescribe the right dose, what type of food the patient has to take.
So the physician is no more giving you the medicines or the type of medications that you are going to...
Actually, he is consulting the clinical pharmacist because, you cannot give medicine without knowing what type of food the patient is going to have. Or
if they are on another medications, for example.
Yeah, or he gives 2 or 3 medication at the same time, maybe drug interaction or drug-food interaction, which inhibit the effect of the drug, prevent it from absorption and produce its therapeutic effect.
Okay.
So this is the job of pharmacy. Also the dose is calculated according to the age, to the weight, to some sort of these matters, So the pharmacist is doing the whole calculations to give the right dose. Of course, it is not, they are not working individually with, from each other, they are working as team. So they have to consult each other for a successful treatment for the patient.
Yeah.
Yeah.
So these are the main recommendations for the newly graduates of Faculty of Pharmacy. If you are a newly graduate, there are a variety of places that you can go and work for, as Professor Farouk mentioned, in the Ministry of Interior or other places and ministries as well. So it's not only these 2 fields, medical rep or just selling drugs in a pharmacy. I also want to know things or topics that you tackled during this meeting. There was something about boldness, and mainly boldness in females. Let's first, Professor, talk generally about boldness in males, and then to talk about boldness in females as well.
Yeah. Generally speaking, boldness affects both male and females. And it means loss of hair from head or the body, or both of them. And the causes are different. Some of them are hereditary, which from fathers, mothers, or relatives, close relatives. And mainly because some hormones in the body of both male and females, like testosterone, convert to some sort of reduced testosterone. This is scientific things, which is more potent than the testosterone. So this dihydrotestosterone concentrated in the hair follicles and prevents the hair follicle from its nutrition, and eventually becomes weaker and hair start to fall. This type of alopecia called male pattern alopecia, or androgenic alopecia, because it is related to the androgen, which is the testosterone hormone. So it affects both men and women. We got other types for alopecia. Some may cause some hair patches in the scalp with few hairs in them, which is, they call it alopecia areata, because it's some sort of areas of baldness. And some other type is alopecia totalis, which is complete fall of the hair from these patchy places. We have got another type, which is alopecia universalis, which is loss of hair from the head and from the whole body, even the eyebrows and eyelashes fall down.
This happens, I guess, when people are having a sort of chemotherapy?
Yeah, could be, yeah. This is the cause.
Is there another cause for this?
No. These are the types of alopecia, but causes are numerous. You got causes of this hereditary causes.
Okay.
Some drugs you take may induce alopecia, cause alopecia because it plays with the hormonal balance in the body, so it cause hair fall.
Drugs like what, Professor?
Yeah, Drugs like for chemotherapy,
Okay.
which it gives to
Cancer
oncology
patients.
cancer patient,
Yeah.
may cause this hair fall. Some drugs prevent hair fall, may be used to prevent hair fall. We got the stress factors as well. Stress factors, you know, people afraid of something or worry about their jobs or whatever their children, this will disturb the physiology of the body.
Yes.
And
Will result in hair fall.
Because hair fall, you have got as well as this radiation treatment for cancer patients as well, who are treated by radiation. People, especially ladies with what is called polycystic ovary syndrome, produce some testosterone, and it convert to dihydrotestosterone precipitated in their hair follicle, and cause hair loss.
Really? What I know about the polycystic...
Or they may cause what is called hirsutism at the beginning.
Extra hair.
Extra hair in the body.
That's what is common.
Yeah,
that's what I
hirsutism.
know, that polycystic ovaries,
syndrome,
they do have more testosterone, so they are going to have more hair.
Hirsutism, yeah.
Yes.
But if this testosterone converted to dihydrotestosterone precipitated in the hair follicle, will
it
cause...
will lead to the opposite,
Yeah, will cause the hair loss. Yeah.
Yes.
There are different factors affecting
yeah.
this.
Now we know something that is new, that what we know and what was coming to us, that polycystic ovaries, they do produce more testosterone, so that's why a female who are complaining about this problem, most of the time it's because of the testosterone, and now we know that it could be converted into hair fall as well. About the solutions of that problem, how it could be solved in both males and females, and how to deal with baldness, if there's any type of medications that we can take orally or we can put on our skull so that it would improve our hair and prevent it from being fell. We are going to have a report, and we'll be back. Please stay tuned.
Dr. Zuhur Ibrahim, lecturer of Forensic Analytical Toxicology, Riyadh Colleges of Dentistry and Pharmacy.
Nice to meet you, doctor, and we just want to know more about the organization of such a conference and the programs and sessions included in that conference.
Well, the 6th Riyadh International Pharmacy Meeting, under the title of Broadening the Impact in Pharmacy, is held under the supervision of the government of the custodian, King Abdullah bin Abdulaziz, may God bless him. Have really a great and interesting scientific program. It includes many lectures, posters, exhibitions, and it has and interesting lectures that everybody can come here and attend and listen to the new developments and new interesting scientific things. The program also has been organized under the supervision of many governmental societies like the Health Council, and also under the supervision of the governmental Saudi governmental health sciences. The program will be accredited for 14 hours, which I think will be really good for the future for many of the pharmacists that will be in this meeting. Also, you can find here exhibition. Many companies participate in our and share in our conference, and really they put very lovely things that everybody can enjoy and have fun. So we wish for everybody to enjoy our conference and to come and to gather and to see all of these scientists all together. Thank you very much.
Welcome back, and Professor Farouk, I want to ask about the signs of baldness. How can I know that I'm facing a problem because all of us, when we are grooming our hair, we see that there's a lot of hair that do fall. So when can I consider myself as a patient?
Yeah. There are some tests you can make it at home, and
Yes.
some tests can make it with a dermatologist as well. So this simple test you do at home is to perform what is called the pull test. Just to pull your hair, not strongly, just try to snatch some hair by the fingers, and if more than 10 hair comes in your hand, it means that you are prone to alopecia. Your hair is falling down, and you need to restore it. It must not be more than 3 hairs comes in your fingers.
Okay.
You got what is called the early morning combing. If you comb your hair in the morning, you collect the hair fall, and by the end of the month, count them. So there are a special number which indicate, if it is more than this number, indicates that you are prone to alopecia, or you're having alopecia. You find batches of hair, batches of your scalp empty from hair, or the hair is just little or weaker like that. Patients who are suffering from dandruff may be prone to alopecia. People who are suffering from too much sebum in the head. Sebum is a secretion in the head. They call it fatty
Yeah, when
head.
you feel like your hair is greasy,
Greasy,
and you really need to wash it every day.
This is good nutrition for bacteria and fungus. You don't see them. And people, they don't say, I don't have bacteria, I don't have fungus. But really, in the presence of this sebum, there are bacteria and fungus hidden inside the hair follicle.
And the solution of that problem, I know a lot of people who do have greasy hair, they wash their hair daily so that it would look fresh, I mean, but I know also that washing your hair every day is not good.
It is not good.
Because also it will cause hair fall
Detergent
later on.
cause hair fall, using dye and hair straighteners, which is straighten hair. Just hot treatment.
You mean the babyliss or the keratin therapy and